very quickly, just touching base on the adverse effects, they include cytokine release syndrome, neurotoxicity, hypogammaglobulinemia, which means there's low levels of immunoglobulin in the blood, low blood counts, and also a new unique side effect that we are seeing specifically with talquetamab, which are skin, nail, and taste changes. How do we manage these? For cytokine release syndrome, we diagnose it by the presence of fever, low oxygen saturation, low blood pressure. But mind you, for most of these bispecific antibodies, thankfully, the grade of cytokine release syndrome or the severity of cytokine release syndrome and neurotoxicity is actually much less than what we see in CAR-Ts. We treat with IV fluids, tocilizumab, steroids, anakinra. These are all drugs that we give to mitigate cytokine release syndrome. Neurotoxicity is something we actively watch out for in all patients receiving bispecific antibodies. The way we diagnose is the presence of confusion, memory loss, delirium, seizures, motor symptoms, and signs of raised pressure in the brain, like having blurry vision and headache, etc. Neurotoxicity is very rare and thankfully very mild compared to some of what we have seen in CAR-Ts. The treatment is again very similar to cytokine release syndrome. We are increasingly starting to see that low blood counts and low immunoglobulin levels that are lasting long-term are now a problem with bispecific antibodies. And the way we diagnose them both is by doing blood tests. There's low immunoglobulin levels in hypogammaglobulinemia and also low blood counts, which we look by CBC with low WBC, hemoglobin, and platelet count. For hypogamma, especially with patients who are highly susceptible to infections or COVID or have had severe COVID in the past, we give monthly infusion of IVIG until recovery. And for those with low blood counts, we treat with supportive care with transfusions and growth factors like Neupogen, Neulasta, Retacrit, etc. Talquetamab deserves a special mention because we have seen some unique changes like onycholysis, meaning the nails kind of separating off from the nail bed. There are some nail changes that happen, and also skin peeling, which is called palmoplantar desquamation. We typically tend to treat them with topical steroids, vitamin E, and lac hydrogen solutions on the body.